You'll note when we were designing this, I didn't make a PowerPoint for this part, largely because we figured by now you'd have PowerPoint poisoning. So I just wanted to pick up on a couple of threads. And I thought I'd start out, one, with a fact correction. I want to note that I'm afraid that the 350,000 number will have a life of its own. The actual number is 340,000 that's in the Wall Street Journal article. I suspect by now we may be up to 350,000 Coloradans who live close to an oil and gas well, but it's within the margin of error. So just that quick correction. If the people start saying 350,000, you can blame it on Adgate. So you've heard a lot of stuff today, and I mean, when you hear academics talk, and I want to move beyond academics, but you're often going to hear us say at the end of our talks, more research is needed, because that's what we do. Now, one of the issues with this particular issue is we have to make decisions on the fly. I don't believe that oil and gas, even with the ballot initiatives, is going away. It exists in our communities, and the real question is how are we going to deal with this technology in such a way that we can live with it, and reassure a concerned public. I want to go back to something I said in the early part of my talk. Is I think one of the real tensions here is between these technology-based standards and health-based standards. I mean, a lot of the things that I hear in the public media seem to imply that if you have a standard, it must protect health, and most of our standards don't actually do that. In I think in a manner that most public health scientists would say is rigorous. I'm okay with that, but I think in the interest of transparency, we need to be clear about that. We're doing a lot of the new standards. As I mentioned earlier, the new methane standard doesn't actually address health in any way. It's all about control of methane. I think that there's a number of ancillary health benefits. You're likely to control ground level pollution to a number of things because of it, but let's not pretend that it actually has anything to do with health, because it doesn't. But the benefit notwithstanding, or the possible benefit notwithstanding. So that said, how we go about doing regulation and health protection going forward, and I'm not sure that regulation is always the right answer. I want to point out, I think health protection can be done a number of different ways, and it doesn't always require regulation, but it does require things that have teeth, that are based on science, that there's an actual incentive to do it right. I think some of the things you heard, if you talk to, pull Eric Eswine aside and talk to him a little bit about some of the silica stuff, you'll hear some really interesting things that are going on about trying to control silica risk. One real simple, I asked Eric the question this morning about, well, what if we just added water to everything every time they're handling sand? Wouldn't that deal with the problem to a certain extent? And you could ask Eric the same question, but the answer is yes, but it still is going to mess with the system that they have in place and the technology they have in place for moving a lot of sand around so they can conduct operations. So there's science, there's programs that can, I think, address real risks, things like silica, things like air pollutants in people's neighborhoods, but it needs to be based on, to go back to my original statement, more science is needed, more research is needed. Having that science, and if you get to the end, if you want to read the review paper, one of the things that I put forth, my co-authors and I did, was that the real issue around this is there hasn't been a lot of funding on this issue, and something like the Health Effects Institute, some sort of public-private partnership that actually funded substantive research to address the questions, set research priorities, I think is really needed in this area, because the problem's not going away. I don't believe the industry is going away, even with ballot initiatives in this state. So what we do going forward, what sort of research we do, how we set priorities, how we assure people about protection, I think are kind of the key issues as we try to move to the next stage in this delicate dance in terms of assuring the public and protecting the public around the real risks that exist around these operations. That said, I note it's just about 2 o'clock. I think we can have a question or two, and then we'll take a break. The next section at 2:20 will be the group of us and anybody else answering questions from the audience, and Patty's going to moderate that. So.
I got one. John, when it comes to public health studies associated with air quality, is your impression that other large sources of emissions, be it power plants, vehicular traffic, dry cleaners, what have you, are better understood and have been better studied? Or is there a phenomenon because of the tremendous growth in oil and gas development, the fact that it's coming into communities that aren't used to it, that there's so much focus on this industry?
Yeah, well, yeah, obviously they've been better studied because this industry as it exists now is radically different. I didn't wrap Jeff's knuckles on this, but I disagree with fracking has been around since 1940 as a talking point, largely because it's, the unconventional resource extraction, directional drilling and all that is so radically different in scale than what went on before. I mean, when they frack a water well with water, they add 50,000 gallons. We're not talking millions of gallons. We're not talking adding chemicals. We're not talking adding silica. We're not talking 16 wells in a pad. So it's a very different, activity. That's my main point. So, to go back to your question, all those other things have been studied, I think, a lot better. Luckily, they've also developed tools through those. And there's a lot of things, as Tony's talk this morning indicated, there's a lot of things that are methods and science that I think is applicable to this problem, particularly around particulate matter and VOC, both measurement and modeling, that can be brought to bear in this, so you could do sort of substantive, comparative studies. I still think you need to get to the baseline studies where you start looking at exposure and health effects and tracking them over time, so then you can, we can compare, to other sources in useful ways.